Hello, my name's HAZEL. I am an anaesthetics trainee at Barts, and I am going to be showing you how to use the Datex-Ohmeda Aespire view in our ITU setting. You will take your Mapleson C or Waters circuit and attach it to the auxiliary oxygen here. And we will check that the machine is plugged in. Now we can turn the machine on. Once you turn the machine on, it will go through its own digital checks. Once the digital checks are done, you need to check that the rotameters are working. Now, we've checked that there is flow in this area, but we need to check that these rotameters work. And to do that, we're just going to turn them all the way up to the top, check that they move smoothly and that they are rotating, and then turn them off again. And we'll do that with the oxygen and with the air. And I can see that that's rotating. The middle rotameter should not rise because the nitrous oxide is not connected. However, when you turn this, you will see the oxygen rotameter rising. Just make sure that this rotameter is set to 0. Rotameters like this are read from the top of the bobbin. So this says 5 litres from the top of the bobbin. Whereas rotameters, which you're probably more used to with this ball, are read from the middle. So this says 7 litres. The next thing to do is to check that your circuit has no leak. To do that, we'll attach a bag to the end of the circuit, check that this CO2 line and this CO2 line are securely fastened, that it is attached at the back of the machine, and that this is plugged into the gas module here. We are going to test this circuit on volume control, which has come up on the screen already. We will use 500 mils tidal volume, so I'll change that by pressing this button to highlight the tidal volume, turning the knob here and pressing it in to select 500 mils. And we will test at a rate of 14 breaths per minute with a maximum pressure of 40 centimetres of water. We will test it with the flows up at 1.5 to 2 litres, and I will now switch on the ventilator. You may need to fill the bellows, and you can do this by pressing this button here. This is the oxygen flush button. It should never be pressed when a patient is connected to the circuit, because it essentially applies the pressure from the back bar to the patient, which can cause barotrauma. To complete the test, you need to watch the bellows rise to the top for 1 minute. If there is a leak, it will look something like this in the bellows. They will not rise completely to the top, and eventually they will completely collapse. If this is occurring, there is a leak in the circuit, you should ask an anaesthetist or an ODP to come and check the machine. The next thing to do is check that the alarm parameters are all set correctly. To do this, I'm going to select the menu button here. That brings me to this screen, and I can use the green dial to turn it to highlight alarm setup, press it in to select that, and it brings me to this screen. The oxygen alarm defaults to 20 as its lowest oxygen it will accept. This is too low, and we want to change that to a minimum of 40. To do that, I can highlight the 20 by selecting it with this green dial, rotate it until the number says 40, and then press it in again to select that. The higher alarm should be left to off. The minute volume alarm should be changed to a minimum of 4 and a maximum of 10. So again, I'll highlight that, rotate the dial until it says 4, and select that change. To move along, I'll rotate the dial one more time, select, change it to 10, select again. The tidal volumes should be set according to your patient's size. So for instance, a minimum of 300 and a maximum of 660. The leak audio should be on, and we can return to the main menu now. The maximum pressure alarm is set within these settings at the bottom here. To change it, we select this and we can bring that down to a maximum of 35, should be adequate. Now we can go through the ventilator modes that are available. If I press the menu button again, it brings us to the screen and I can select ventilation mode. We have volume control ventilation, pressure control ventilation, and down here, pressure control ventilation volume guaranteed. These three are your mandatory modes. In these modes, the patient cannot trigger a breath. If the patient starts to breathe against these modes, you'll see signs of them fighting the ventilator. It will register high pressures and alarm, and you may see some observation changes on their monitoring. On the volume control mode, these are the things that we can set. The tidal volume, the respiratory rate, our I to E ratio, the maximum pressure above which it will alarm, and the PEEP, which defaults to off, and we can set to something reasonable. Clicking on More Settings brings up this screen, which just shows the maximum pressure and something called T-pause, which should be off. And I can come back to the normal screen. Looking at the other ventilation modes, if we check pressure control ventilation, it brings us to this screen, and I have to set a pressure for the inspiratory pressure before it will change the mode. To do that, I used my green dial to set an appropriate P-insp, select that, and you can see here it's changed the module to be delivering pressure control ventilation now. In this mode, you can set your P-insp, respiratory rate, I to E ratio, again your P max above which it will alarm, and the PEEP. In more settings, you get the same and leave rise rate on auto. In pressure control volume guarantee, you set a tidal volume, and again, once you select that, it has now started to use that mode, and the other settings are the same as in pressure control. That includes more settings here, and we'll leave the rise rate at 5. Let's look at the other modes now. We have SIMV pressure support ventilation and SIMV pressure control. Our SIMV modes on this machine have less sensitive triggers than the standard ITU ventilators. You can set along here the tidal volume, the respiratory rate. Instead of setting an I to E ratio, you have to set the time of inspiration. We suggest that you set that between 1.3 to 1.6, leaving that at 1.4. And you can set what pressure support the patient will receive if they trigger a breath, and the PEEP. If we look at more settings, there are a few more things to go through here. The P max should be set at 35. The trigger window is the time in which the patient is allowed to trigger a breath during expiration. We're suggesting to leave that at 25. The trigger is in litres per minute. So if the patient triggers via generating a negative flow, the machine will sense this and deliver the pressure support. This I'm going to change to 2 by selecting it to highlight it, changing the number using the rotating dial and pressing that rotating dial to accept that change. The default should be 2 litres per minute. The end of the breath should be at 30 seconds, and we will leave T pause to off and rise rate to auto and come back to our normal screen. Going through SIMV pressure control, it is very similar. We set our pressure support, and once we accept that pressure support, again, the mode is now delivering SIMV PC. And if we check more settings, it's the same settings as it was on the other SIMV mode. The last mode to go through is our PSV Pro. This is our pressure support mode. Selecting this, I can see the numbers along the bottom here. Our PINSP respiratory rate and TINSP are all in small numbers because these are the backup numbers. We can set our pressure support. Selecting that allows the mode to change, and we can set our PEEP. In this one, importantly, we must go to more settings and check that all the other settings we looked at before are the same. So our Pmax at 35, our trigger window at 25, our trigger at 2 litres per minute, and our end of breath at 30%. But we also must change the backup mode active. This is our apnea time. It sets at 30 seconds. It defaults to 30 seconds. I need to change that to 10 seconds. And we can return to our normal screen. Now that all of the numbers on our modes are adequate, we can start ventilating. But to do that, we need to dial up a flow. In SIMV mode, because we set the TINSP, not the I to E ratio, you must be very careful using high respiratory rates on this mode. Using high respiratory rates without changing the TINSP could cause your I to E ratio to invert. So if you are increasing the respiratory rate to a high level, you must turn down the TINSP to make sure that you're not inverting the I to E ratio. Because this machine has manual rotameters, we have to actually calculate the gas mix ourselves to try and approximate what FiO2 we are going to deliver. We also have to decide how many litres per minute we're going to provide to the patient. We're going to set our litres per minute originally at a minimum of 10 litres per minute. This might need to increase if your patient's minute volume is higher. To set the gas mix, we are going to provide you with FiO2 tables that will give you a reference of how many litres oxygen you should dial up and how many litres air you should dial up to get an approximate FiO2. For example, if I look up on the 10 litre table and aim for an approximate FiO2 of 50%, it will tell me to dial up the oxygen to 4 litres and the air to 6 litres. This will give me an approximate FiO2 of 50%. However, the actual FiO2 you are delivering, which is what you need to write down on the charts, is on this screen here. It is written here, and it will take some time to change, so keep an eye on this number. For monitoring the ventilation settings, the numbers that come up on this screen here are the peak pressure, the mean pressure, the FiO2 in the circuit, and the expired tidal volume. You can also get a minute volume and a respiratory rate from here as well. But to get the other numbers for the chart, you'll need to set up the split screen on the monitor above. To get the other numbers for ventilation monitoring, we'll need to set up this screen. This is the screen our spirometry leads are attached to, And to do this, we need to go to Monitor Setup, Screen Setup, and Split Screen. To increase the FiO2 to 100%, either to pre-oxygenate a patient or if they're desaturating, you'll need to manually change the flows on these flow meters here. You'll need to increase your oxygen flow to whatever your maximum flow was and turn off the airflow. This will not instantly raise the FiO2. It will take some time, and you'll need to focus on the number on this screen here and watch that rise to 100%. This may take a little while. If you want to increase it very quickly, make sure that you increase this oxygen flow meter up to its maximum of 15 litres. Unlike the ventilators you may be used to, this ventilator can't compensate for any airflow removed from the circuit by suctioning. If you're doing repeated suctioning or deep suctioning, such as in respiratory physio, you will need to manually compensate for this. To do that, you should be turning the flows up before suctioning and keeping them elevated throughout. You may still see that the bellows don't come to the top. If the bellows are collapsing, you need to make sure you increase the flow. If, for whatever reason, they don't return to the top after the suctioning is finished, you'll need to get help. There are two more reasons why your bellows might not fill to the top. Either the flow that is dialed up here is less than the patient's minute volume, in which case you'll need to increase the flow by 10% and that should fix the problem. Or there is a leak in the circuit, in which case you'll need to increase the flow by 10% and make sure that you get help. It's not always possible to tell the difference between the two, so if the bellows are collapsing, increase the flows and call someone like an ODP or an anaesthetist to come and check the machine urgently. The other reason why you might need to increase the flows is if the alarm goes off on the monitor that says inspired end tidal CO2 high. That means that the flow we have dialed up here is not high enough to wash out all of this carbon dioxide the patient is making from the circuit, in which case you'll need to increase the flows and again get someone to come and check the machine.